Hello friends, I'm Dr. Amlani and today I'm going to show you how you can customize a resin matrix system for restoring a deep subgingival carious lesion. Severely mutated teeth always pose a problem to the clinician when it comes to restoring an endodontically treated tooth, since the carious margin are extended subgingivally and many times subcrestally. Today, a large number of metric systems are available commercially on the market. Copper bands are also being used, but since they involve a cumbersome procedure of trimming them and adapting around the tooth, the other prefabricated metric systems such as saddle metrics or sectional metrics are used and preferred. But despite of them, when the caries extend subgingivally, many times these bands do not adapt well to the tooth. To illustrate this, let's have a look at this picture. When the caries extend subgingivally and you try to adapt a band in that region, that band will leave a ditch below the restoration, as you can appreciate on an image towards the right. Despite of having a good proximal contacts built up, there is a marginal ditch below the restoration which leads to marginal leakage and failure. So let's have a look at this case, tooth number 27, which was referred to me for retreatment. If you closely notice the radiograph, you will observe that the proximal caries is extending subgingivally and slightly subcrestally also. Now there was a gingival growth in this proximal carious lesion. So here you will see how a customized resin matrix can be fabricated. Now, once a carious lesion is excavated and a sound tooth structure is reached, a localized gingivectomy procedure is carried out using laser. Here, you can also use thermocut burr or electrocautery depending on your preferences. A good hemostasis is a must. Once you have achieved a hemostasis, the gingival tissue is covered with a liquid dam and light cured. Layer by layer, you go on adding this liquid dam till the level the wall is formed and you reach the occlusal surface. You finish the internal surface of this liquid dam by a thin finishing burr. Once that is achieved, you can fill the rest of the endodontic cavity either with composite and light cure it, or you can even pack amalgam. Once the amalgam is set for the initial 15 minutes, thereby you can remove this band of resin matrix either with an explorer or with a finishing burr. Let's have a look at another case of a severely mutilated lower third molar. Now, strategically, this tooth is very important to save by doing endodontics, since this tooth is to be used as an abutment for fixed processes. Now, if you look at the marginal ridges and the caries extension in the mesial wall, you can appreciate how subgingivally the caries is extending. Here, restoring and adapting a matrix system is a difficult task. So here, the same procedure was performed as described earlier. After caries excavation, a localized gingivectomy procedure was performed and a good hemostasis was achieved. Thereafter, a layer of resin matrix, that is liquid dam, was applied all around the circumference of a tooth and light cured. This was added layer by layer and a wall was formed till the occlusal surface. Once that wall is formed, the rest of the endodontic access cavity was packed with amalgam and allowed it to set for 15 to 20 minutes. After the initial set of amalgam, this band of resin matrix was chipped off using explorer, or you can even use a finishing burr. Now here's another case of an upper premolar which was referred for retreatment. Despite of it having a supracrystal and supragingival margin, to illustrate how we can adapt the same methodology in restoring this tooth. So let's After the retreatment was performed, a wall was formed on the distal aspect of the tooth from the gingival margin till the occlusal surface with a liquid opal dam, and it was light cured. Once the wall is formed, the entire endodontic cavity, excess cavity was filled with amalgam and allowed it to. After the amalgam was set initially, the thin band of resin matrix was removed with an explorer. Now here you can appreciate how well the amalgam is adapted to the cavo surface margin of the tooth. So this demonstrates that even in the difficult situations, you can adapt the post-endodontic restoration to the cavo surface margins. Guys, I think this small clinical tip will help you in achieving a good post-endodontic restorations. I thank you for the same. You can connect with me on Facebook and Insta. Thank you so much.